Okay, next slide, Nicole. All right, so what we're going to cover during the webinar is several different topics. So first, for those of you who may not be as familiar or need a slight reminder, we're going to go over the ACL mission and vision, and then talk about some of the new state plan guidance highlights. Next, we're going to move to the state plan due dates for every state and territory. This is just to give you a brief reminder of when your state plan might be due next after this state plan guidance goes into effect, which will be for any plan from due July 1, 2022 and in the future. Next, we're going to talk a little bit about how the new state plan guidance has changed due to the 2020 reauthorization of the Older Americans Act, as well as the inclusion of the Biden-Harris administration priorities and how they relate to the new state plan guidance. Next, we're going to have a slide and discuss what goes into the state plan, the content, um, and then we'll turn to the state plan key topic areas and attachments to the state plan. And finally, we're going to sum it up with some resources to help develop your state plans, provide you a sample timeline that can work for your state but is not required. Um, then we will turn to questions and answers. So if you do have questions, we would just ask that you hold them in the Q&A feature of the WebEx webinar, and Chris and I will get to those after the slides. So there's a chat function, participants, and then if you hover over the three little dots next to chat, there's a Q&A option as well. And finally, this is one of actually 3 trainings we're going to be doing on the new state plan guidance. We're also going to be doing 2 more over the next 2 months, and so we'll give you some more information about those. And finally, give you Chris and I's contact information for any follow-up you might have. Nicole, next slide, please. So just as a reminder, here at the Administration for Community Living, our mission is to maximize the independence, well-being, and health of older adults, people with disabilities across the lifespan, and their families and caregivers. Next slide. Our vision is that for all people, regardless of age and disability, to live with dignity, make their own choices, and participate fully in society. And now I'm going to turn it over to Chris to go over the next set of slides related to state plans. Chris?
Thanks, Brian. I'm happy to be with you all today to talk about the new state plan guidance. We sometimes call it the new SPG. ACL issued the new SPG in August of this year. It replaced the state plan guidance that we last issued in 2019. The new state plan guidance applies to any new state plan taking effect on or after October of 2022. It incorporates key changes from the 2020 Older Americans Act Reauthorization, and it also includes priorities from the Biden-Harris administration that shape the work that we do at ACL. Next slide, please. So as Brian mentioned, the next several slides show state plans that are due to ACL. All state plans are due to ACL on July 1st of any given year. And I won't read every state and territory that are listed on the next few slides, but it'll be a good reference for you if you want to make sure that you have the same information that we have at ACL. So the first slide shows state plans that are due on July 1st of next year, 2022. Next slide, please. And then state plans that are due to ACL on July 1st of 2023. Next slide. July 1st of 2024. Next slide, please. And finally, the state plans that are due to ACL on July 1st of 2025. Next slide, please. So now I'll cover how the 2020 reauthorization impacted the new state plan guidance, and Brian will follow and cover the Biden-Harris priorities. In terms of the reauthorization, I'll discuss social isolation, caregiving, nutrition, and malnutrition. Next slide, please. So let's take a closer look at social isolation. The term social isolation appears in the Older Americans Act 7 times. Social isolation and loneliness can have a devastating impact on health and well-being. In the reauthorization, the law amends the definition of disease prevention and health promotion services to include screening for immunization status, suicide risk, fall-related traumatic brain injury, and other fall-related injuries, and also social isolation. The Act also amends the list of authorized supportive services under 3B to include services that promote or support social connections and reduce social isolation. Next slide, please. As it relates to caregiving, the Act defines a new term, caregiver assessment, in 372A1. The Act amends Title III to address younger onset Alzheimer's disease by specifying that family caregivers can care for individuals of any age with Alzheimer's disease. It also removes the National Family Caregiver Support Program's funding cap for support services to older relative caregivers of children and young adults with severe disabilities. Lastly, it extends the sunset date for the advisory council established under the Supporting Grandparents Rating Grandchildren Act, and it extends it to July 7th of 2022. Next slide, please. Okay, nutrition and malnutrition. In the reauthorization, reducing malnutrition was added as one of the purposes of the Nutrition Services Program. You can find that in Section 330. In Section 102.14b, there's language related to the definition of disease prevention and health promotion services, and that includes screening for malnutrition. The reauthorization in Section 308 also points out that SUAs and AAAs should reduce administrative barriers related to transferring funds for nutrition services so that resources are where they're needed the most. And now I'll turn it back over to Brian.
Thanks, Chris. So now I'm going to cover the 4 Biden-Harris administration priorities that are set out for ACL and how they relate to the new state plan guidance. So first, there's COVID-19 recovery. Next, we'll talk about advancing equity. Third, expanding access to home and community-based services. And fourth, building a caregiving infrastructure. Next slide, please. We all know that the devastating impact that COVID-19 has had on all of America, but in particular, older adults as well. We have seen significant disruptions in the aging services network, and at the same time, both Congress and ACL have provided significant flexibilities under the OAA as it relates to various programs during the various aspects of the COVID-19 epidemic. In addition, the Aging Services Network has been provided large sums of supplemental funding, both through congressional appropriations and supplemental funding bills, as well as funding that was transferred from the CDC to ACL to provide to the Aging Services Network. Finally, we have seen an increased need within older adult community for services under COVID-19. So what we're asking is that when you are putting together your state plan in the future years, you discuss how COVID-19 has impacted your state, how it's impacted your aging services network, and what you will be doing to plan for the future, both in terms of COVID-19 recovery, as well as specifically with the funding that may be left over in future years. So for example, the American Rescue Plan funding that states received in May of this year, that funding is available till expended, and the project period is through 2024. And as a result, much of this funding will be available to some of these states that have plans due in 2022, 2023, and 2024. And therefore, we'd like you to focus on how you're going to spend those leftover remaining dollars, as well as any other supplemental funding you've had, and how you've innovated your programs as a result of COVID-19 and how you're going to move those forward. Next slide, please. Next, we have a priority around advancing equity. We know that the Older Americans Act has always advanced equity with it on serving those in the greatest social and economic need. But the Biden-Harris administration has put a particular focus on advancing equity and specifically on a broad approach. So via various executive orders by President Biden, he has noted that when we are talking about advancing equity, we are talking about individuals who are Black, Latino, Indigenous and Native American persons, Asian Americans and Pacific Islanders, and other persons of color, as well as members of religious minorities, lesbian, gay, bisexual, transgender, and queer persons, persons with disabilities, and persons who live in rural areas. In addition, we know the OA also includes individuals with limited English proficiency and those at risk of institutionalization as groupings who should have funding targeted to them. So as you are developing your future state plans, we want to make sure that you're including all of these populations in how you're going to do outreach, education, and develop goals, objectives, and outcome measures. Next slide, please. The third priority is expanding access to home and community-based services. We realize that this is sort of the bread and butter of what many of you do all of the time. And so you may be asking, well, why is this a particular topic area or a specific emphasis of this administration? And what specifically are you looking for in the state plan related to this for this particular topic area? And so what we would say is, well, how is the state building HCBS capacity? So for example, we know that the American Rescue Plan provided an FMAP bump of 10% to home and community-based Medicaid services, at least for this fiscal year, and that funding can be used in future fiscal years as well. So how are you planning to work with your state Medicaid agency in that FMAP bump spending for home and community-based services? How are you working together and how are you expanding capacity? In addition, the American Jobs Plan from President Biden, which is now being incorporated into the reconciliation bill in US Congress, there is the multi-billion-dollar investment in Medicaid home and community-based services. And should that come to fruition, how are you working with your state Medicaid agency and others to build out that funding base of home and community-based services in addition to the Older Americans Act programs and funding? So we want to see in that state plan how you're building capacity and how you're improving those programs' quality through innovation, partnerships, and other state and local partnerships with other state and local agencies, as well as community-based organizations, both within and outside of the aging network. Next slide, please. Finally, the Biden-Harris administration has a lot of priority around the caregivers and caregiving infrastructure. And so again, there is much in the American Jobs Plan around family caregivers and family leave. In particular, though, for the state plan guidance, we're thinking about how states are going to build off the key findings from the Raise Family Caregiver Advisory Council. They just sent their report to Congress last week, and that report includes 26 recommendations as it relates to caregiving. In addition, the Raise Family Caregiving Advisory Council will be putting together a national strategy for the federal government, states, localities, community-based organizations, et cetera, how can implement that across the country. And so we're looking for states to include in their state plans how they're going to build off of both the Caregiving Advisory Council's report to Congress and recommendations, as well as the eventual national strategy, which we anticipate coming out in 2022. Now with the next slide, I'll turn it back over to Chris. Chris?
Thanks, Brian. So next, let's talk about the different components required in every state plan. Every state plan must have a signed verification of intent. The verification of intent must be signed by the governor or someone that is authorized to sign on the governor's behalf. If the plan is signed by an authorized designee, please include documentation that shows proof of the designation. This section will also typically include whether the state will operate under a 2, 3, or 4-year state plan and include the dates that the state plan will be in effect. Outside of the attachments, the narrative section tends to be the section with the most information. The narrative section includes an executive summary, a context section, a quality management section, and a goals and objectives, strategies, and outcome section. The executive summary should be no longer than 3 pages, and it should summarize the state's plan efforts as outlined in the state plan. States use the context section in a number of ways. Sometimes they discuss emerging trends that they are seeing. They put information about how the state plan was developed, including specific information related to the needs assessment and public input. In terms of the quality management section, I sort of see that as the continuous quality improvement section. Here you can talk about how you collect data, how you manage using data. You can also use this section to discuss the results from quality management activities that you recently conducted or that you plan to conduct within the state plan period. The last part of the narrative section is the goals and objectives section. And as Brian mentioned about some additional trainings, we have a training plan for November 15th of this year that will give states tools for developing performance measures with clear outcomes. So I won't go into that a whole lot today, but there is a direct connection between the goals and objectives section and the state plan key topic areas. And I'll talk about those next. Next slide, please. Okay, there are 5 state plan key topic areas. They include the Older Americans Act core programs, COVID-19, equity, expanding access to HCBS, and caregiving. Each key topic area includes areas to address. We ask states that they develop goals, objectives, strategies, and outcome measures that show their progress towards the areas to address. So the goals and objectives section and the state plan key topic area section really go hand in hand. I will talk about the state plan key topic areas in more detail. Next slide, please. The next few slides are screenshots from the new state plan guidance. This slide shows the Older Americans Act core program topic area and the areas to address for that particular topic area. I won't read every area to address. However, I highlighted a couple new areas to address based on new provisions in the Act, like addressing malnutrition and 3B supportive services for screening for fall-related traumatic brain injuries. Next slide, please. I've also highlighted a few areas to address in the COVID-19 topic area. One is associated with social isolation. Another is related to screening for suicide risk. And the last one I highlighted is about the State Assistive Technology Agency and access to assistive technology. Please remember that you need goals, objectives, strategies, and outcome measures for every area to address that is applicable to your state or territory. Next slide, please. In the equity topic area, please note the new areas to address around cultural considerations and preferences and providing medically tailored meals, supporting cultural experiences and activities and services, along with serving older adults living with HIV and AIDS. Next slide, please. In the expanding access to HCBS topic area, I highlighted incorporating aging network services with home and community-based services provided by other entities such as Medicaid. And Brian mentioned that a little bit earlier. Next slide, please. Lastly, in the caregiving topic area, I highlighted implementing recommendations from the RAISE Advisory Council. Like Brian mentioned, the council delivered its initial report that includes recommendations to Congress just last week. Next slide, please. So another important part of our state plans are the attachments. There are 3 main attachments that every state plan should have. Attachment A are the state plan assurances. These are required activities and assurances from the Act. The assurances must be reviewed and signed by the SUA director. In addition, documentation of how the state will address each assurance must be maintained at the state and made available for review by ACL as requested and appropriate. For example, there is an assurance that a mechanism must be in place to identify and remove conflicts of interest prohibited by the Act. ACL could ask the state or territory to provide its policies and procedures that speak to that. As far as attachment B, the information requirements, that's a list of questions derived from specific parts of the Act. The state must provide a detailed response to each question. For example, states must provide a response to how preference will be given to providing services to older individuals with greatest economic need, greatest social need, with particular attention to low-income minority individuals and individuals residing in rural areas. Attachment C is all about the interstate funding requirements. It also has information targeted to single PSAs regarding funding allocation. We have a training on October 20th that will go into more detail about funding formulas. SUAs can also use attachments or appendices for things like detailed needs assessment results or detailed public hearing results. And a lot of states also use the appendices for the emergency preparedness plans to provide ACO with their emergency preparedness plan. Next slide, please. Okay, this slide just shows a list of resources that can assist you when you're completing your state plan. In my opinion, one of the most important ones on the list is the ACO Regional Office. I can't emphasize enough the importance of working directly with your RA during the state plan development process, including allowing them to review your state plan drafts early and often. Next slide, please. So far, we've given you information about how the reauthorization of the Older Americans Act and the Biden-Harris priorities shape the new state plan guidance. We also spoke about different parts of the guidance, like the narrative section and the attachments. We provided some state plan resources, and we connected the goals and objectives section to the state plan key topic areas. This is our last slide before we go into Q&A. It was designed to give you a sample timeline on how the entire process of developing a new state plan could work. We hope you can utilize this as a potential best practice, but we also understand that each state's timeline and state requirements will vary. The timeline is broken down into 5 steps. In step 1, you gather information and do things like conduct public hearings and your need assessment. In step 2, you start drafting using the information you gathered in step 1. You spend a lot of time with the state plan guidance, and you communicate often with your RA and utilize other state plan resources. In step 3, you share drafts with your RA and begin refining after they provide feedback and technical assistance. In step 4, you begin to finalize and obtain the signatures from state officials like the governor. And finally, in step 5, you submit the final plan to your RA. I'll turn it back over to Brian. Thank you.
Thank you, Chris. So now we want to open it up to questions and hopefully provide some answers. As I said, in the bottom sort of right-hand corner, if you hit the 3 little dots, there is a Q&A function. And so you can type in a question as a question, and then we will try to address it live. The first question I'm seeing is, can you recommend a needs assessment, or what topics or questions should be included in the needs assessment? Chris, I don't know if you have experience with this particular area or not, or if you think that this question might be addressed in some of the resources we provided in the links.
Yeah, it's definitely something that you can find in some of the links. The Advancing States links has good information related to that. And just from looking at different state plans, I see a lot of different things for the need assessment. Sometimes states can ask very simple questions in a need assessment, and sometimes they're extremely detailed. So it's definitely a range. I recommend working closely with your RA through the process, and also again the Advancing States resource will also be helpful.
Okay, the next question we have is, can you recommend a screening for loneliness and isolation for older adults? So I know that that ACL funds the Engage Center, which is really focused on social isolation and reducing social isolation. So I don't know if Chris or Nicole, you happen to have that website, we can maybe put in the chat function. But at that website for the Engage Technical Assistance Center, they would certainly have tools and resources for different types of screenings that are utilized by various professionals on screening for loneliness and isolation for older adults. So if we can't get that website in the chat function shortly, I see, Lisa, we can maybe follow up with you afterwards. Make sure you have that website and any particular subpages of that related to screening tools. Do we have any other questions? Let's see, I think there's one in the chat function. Do you have recommendations on how to work with the Medicaid office for the FMAP? I think, this is something that your state Medicaid office has been working on for a couple of months now. That's called a section, I think, 9817 waiver application. And so I know that states have had to turn in some of their applications, but they're awaiting feedback from the U.S., Centers for Medicare and Medicaid Services on those applications. And so those are evolving processes. So I don't know the particular contact in your state's Medicaid office, but that is certainly, they have been working on that for a couple of months now and should have information on what they put into that state plan and how to partner with them in moving it forward. Any other questions?
Ryan, there's another question in the Q&A section.
Oh, okay, let me scroll down. Let's see. Some of the new requirements seem overly specific and in the case of TBI screening, far outside the wheelhouse of our providers. Where did this particular requirement come from, and will there be new funding streams provided to build capacity to do this type of work? So I think I can answer the part about where the requirement came from, which is certainly, as I think Chris mentioned, it is within the OAA reauthorization, which was finalized in March of 2020. So that was an added component when the OAA was reauthorized over about a year and a half ago. I don't know that there'll be any new funding streams specific to screening for TBI. I think, Chris, you might be able to remind us which title of the OAA that was added under. I think it was under preventative health, but you could remind us. I know all of the different titles of the OAA have received significant increases in funding through the various supplemental funding bills over the last year or so, year and a half or so.
Yeah, Brian, it's in 321 supportive services.
Okay, so it's that would be part B, right? I think. So we have a question. The guidance previously had a suggested maximum page length. Does ACL have expectations for the length of these pages, of these plans? So I believe previously we had specifically said, I think that the narrative section should be no more than, Chris, 30 pages? Is that right?
Correct. That's
And
correct.
I think what we tried to do, not all of the plans really adhere to that. I think we still think that's a good goal. So I think we like unbolded it or sort of de-emphasized the like we're just gonna cut you off after 30 pages type of scenario because we don't necessarily do that. However, that is still, I think, a recommendation that your narrative section should be around 30 pages, but I think we de-emphasized the page limit because there wasn't a ton of adherence and we certainly weren't sort of just stopping our reading when we got to page 31. I think the next question I see is, will ACL be reviewing requests for extensions for individual states? With COVID response continuing to be a huge priority for SUAs and AAAs, the resources to prepare a state plan are limited. So I think what I would say is that certainly if you have a state plan that is in a year less than the fourth year, then you can make that request. And I know we already received a request from a 2022 state who has a 3-year plan to extend it to a 4-year plan. For those that may be coming due in 2022 for and have a 4-year plan, I think this is something that the statute continues to allow for states to put in a waiver for, and we're looking at how we might think about this for all state plans. But for now, I would say that each state can still avail of themselves of the different amendment processes that exist in the OAA for state plans. Okay, Nicole, can you help me out? Have I
Yes,
got to them all?
you've answered all 7 questions in the Q&A section. The final question was posted in chat, and it was just asking, will there be meeting invites for the upcoming dates that were mentioned for the upcoming trainings in October and November?
So yes, so we're gonna, if there are no more questions, we'll go to the next slide, which tells you when they are. But then yes, like for this training, we will be creating an invite and sending it through the regional administrators to the states that they have purview over, so that you will get a specific invite, not just have to memorize this slide. Chris, you want to talk a little bit about these trainings?
Sure. The first training or the next training will be on October 20th, and that is a funding formula training designed to give information on the IFF, also some information for single PSAs related to funding formulas. And that particular training will be hosted by Rhonda Schwartz. She is an RA for regions 2 and 3, and then also from Alice Kelsey, who is in the central office. And then the third training is a developing performance measures with clear outcomes training. That's in November, and that'll be on November 15th. That'll be hosted by Susan Jenkins. She is an ACL central office employee within the Office of Performance and Evaluation.
Okay, I do see one more question before we move on to I think our last slide, which is, it says sharing draft plans with an external entity, in this case the RA, before they've been approved by the appropriate authorities, secretaries, governor, is not generally how our state operates. Do you have any suggestions for this? Um, I don't know exactly what the question is asking, other than to say I think it is vitally important that you do share those draft plans. I know from my experience with this year's plans that the RAs have been incredible in providing feedback to states on things that need to be added, things that might have been updated recently that you might have missed. Especially with this new state plan guidance, I think as people get used to it, they may not have caught everything in it either. And so really working with your RA, early and often, as Chris said earlier, is really key to making sure that it gets approved. So, I know it might sound like if you turn it in on July 1st and they all have to be approved by October 1st, that is a lot of time for us to review at ACL. However, it's not really a lot of time if the RA has to go back to the state and request a lot of different additions, revisions, ask a lot of questions, and then you would have to send it back through your governor, secretary, et cetera, which I think is not ideal. And then once it is finalized by your RA, Chris and I take a look at the review process, what it looks like, find any information. Sometimes we have to go back to your RA and ask questions. And then we have to send it up to the Office of the Assistant Secretary for Aging for their approval. And so, long story short, I would just say my suggestion is that you work as closely as possible with your RA in the draft plans, so that the time crunch does not exist and you don't have to send it back up through your chain of command because of things that folks at ACL have found as the plan is being reviewed here in the ACL offices. Okay, last slide, Nicole, I think. So I hope you all found this informative and useful. My name, again, I said, is Brian Ullman. I'm the Deputy Director at the Administration for Aging, and this is my email address. And then you see Chris's as well. I think Nicole did put in the chat that we will be putting up the recording and the slides on the ACL website. We can send that link through the RAs as well. It can take up to at least a week because of 508 compliance and making sure there's ways that you can all access the materials on our website in the most available manner. So with that, and no other questions, I certainly want to thank all of you for participating in this training. I want to thank Chris for his tremendous work, not only with this training, but with the state plan guidance as we developed it over the last many months before it came out in August, as well as Nicole for helping out on this webinar and working as an aging uh, specialist within AoA as well on many different issues. So thank you so much for joining us. I hope you'll join us in October and November as well. And with that, we'll say good afternoon. Um, I think everyone now would be in the afternoon. So good afternoon, and please, oh, no, I see a head shaking. Someone must be in a territory. Anyway, have a good day, I'll say. And we look forward to seeing you in October and November. And please, if you have any questions that didn't get answered here, feel free to email Chris or I. Thank you.